Hi guys, very good morning to everyone. I am planning this video from since long ago. Today is the day I finally can do this. So I wanted to discuss some of the wrong MCQs which I have got in my NEET GT which I have taken last Sunday. It was NEET 2022 to 2023 paper. I can say the paper was on easy side. I wasn't able to concentrate on the exam very much because I almost studied 7 to 8 hours that day. Very exhausting for me. So I have taken the exam after the 8 hours of long study, which made me really hectic on that day. So I wasn't able to concentrate too much, but it's not an excuse. I can say, I can be better, I know it. I want to reminisce all the wrong answers I have did in my NEET GT. I hope it will help you too. My sincere request is to all of you that guys, please don't laugh at my mistakes because everyone do that one or the other time, and I hope there are some mistakes for me too because I am really weak at anatomy and surgery subjects. One subject I hate and I never want to take it is like I hate anatomy. I never loved anatomy as such. So because I don't love anatomy, it is little bit difficult for me to answer surgery questions also. This video is about motivating you and as well as motivating me to study more and more for NEET PG 2025. And let's get started. The question was, emptying of the stomach is inhibited by all of the following except increased acidity of chyme, distension of duodenum, CCK secretion and gastrin secretion. This was something I would say, it would be a silly mistake. I don't know why I marked CCK. The thing was, I thought my mind was blank for the first question. I don't know why. Because when I've seen this word cholecystokinin, the one thing which comes to my mind is kinin means something related to motility. Keeping in mind that, I thought emptying will not be inhibited because emptying will be there with CCK, but it's a wrong perception. I didn't see the fourth option at all, which was my another mistake. Gastrin secretion is the answer because whenever we are eating food, of course there will be gastrin secretion, and this gastrin secretion will facilitate the motility of the stomach, and every other thing will inhibit the emptying of stomach. There was this table which is showing everything about differences between gastrin, CCK, secretin, GIP and motilin. In every exam there will be at least one question regarding this table. So I hope this video, this particular table will help you to solve much more questions. So you have to master this particular table. You have to master it, you have to ace it, which I haven't done yet. I will do this all. And there was this another table which was showing factors that increase gastric emptying and factors that decrease gastric emptying. This was my first mistake I have did in NEET GT. We'll go to second question now. The second question, I know this is really silly mistake because after NEET PG 24 exam, I have not really touched all the subjects. I have just started with medicine and surgery. This is somewhat like forensic medicine question. So I actually forgot everything about this. Blackfoot disease is caused by which poisoning? This was the question asked in this GT. The options were as mercury, arsenic, phosphorus and lead. I have marked mercury. I have this confusion about mercury or arsenic. I have changed the option and I know I kept the wrong answer. Basically, mercury poisoning is also known as Minamata disease as far as I can recall. And arsenic is something which will cause raindrop pigmentation on hands. That's what I could recall while writing the exam. And as far as I know, Blackfoot disease is something which is caused by ergot alkaloids when I studied the BTR. But here there was no option about ergot alkaloids, so I kept on marking mercury, but it's not mercury, it's arsenic. Here is the explanation that arsenic causes Blackfoot disease because of hypercoagulability of the blood in the peripheral arteries. And the third one, as I said, I'm not so well, very good with anatomy and surgery questions. This was one of the surgery question which I got wrong. A 31-year-old patient with severe abdominal pain, recurrent retching without vomiting. Actually, this line itself says about some triad. When I see some x-ray questions, and the question is also not so lengthy here, it's just a one line, so my mind was at that time like, I didn't see the question. I just see 31-year-old nasogastric tube insertion was difficult. Seeing the x-ray, that is when I got to know about that this is a gas-filled viscous. So actually I have forgot this triad components. I have kept it as Saint's triad, whereas it turned out to be Bouchard's triad. Because as far as I know, Saint's triad was diverticulosis, gallstones and hiatus hernia. That was a triad of Saint's triad. But Bouchard's triad is something he has already given in the question. It's just that I couldn't recall at the time. I was a little bit confused about Saint's triad and Bouchard's triad. Yeah, and Bouchard's triad is severe upper abdominal pain, recurrent retching. Here it is. Bouchard's triad comprises of sudden onset severe upper abdominal pain, recurrent retching with minimal volvulus, and inability to pass a NG tube are the classical signs of Bouchard's triad, which I have written it in my correction notes because I am a little bit confused. So if you are someone like me, just note it down. Here I have seen the Dilophois triad, which is a classical feature of acute appendicitis, where you can see hypersensitiveness of skin, reflex muscle contraction, and tenderness at McBurney's point. And then Quincke's triad, comprising of it is upper GI hemorrhage, abdominal pain, and obstructive jaundice, because hemophilia is something related to gallbladder, GB tract. So something related to obstructive jaundice, abdominal pain, and the hemorrhage one. This is Quincke's triad. And Saint's triad, as I already said, gallstones, hernia, hiatus hernia, and diverticulosis. And there are so many triads depicting in this particular table. If you want, you can just go through it. For now, I have been doing those 4 and I'm just keeping it in my mind. This was something, the first 3 mistakes are like I was little bit confused. One is recall problem regarding Bouchard's triad. I was not able to recall that question correctly. And the before one was about, that gastric. I am not so clear with the concept. So here, so far, I have got one question regarding which I am not so clear with concept, and one which is recall problem. And this question, a newborn presenting with these signs can be managed in a newborn stabilization unit. So he is asking something about NBSU, newborn stabilization unit, which I have no idea about it. So that's why I have kept it wrong just by guessing it. I have kept 1, 2, 3, 4 are correct, but he says hypothermic who are hemodynamically unstable are really difficult to manage with. And so when I see it now, it makes real sense, because he is asking newborn stabilization unit, which conditions can be managed. Sometimes it feels like before the exam you may not catch the point, but immediately after the exam, when seeing the option, you will have, what, I have kept this question wrong. That type of question is this. I know I have no idea about this, but I think I can manage if I have read these options correctly. That's what you have also to do if you are someone like me. Less severity conditions can be managed in stabilization unit, like without grunting, respiratory rate of 60 to 70, sepsis who are hemodynamically stable, and jaundice who requires just phototherapy. I think these could be managed in a NBSU. A 40-year-old has been diagnosed with lobular carcinoma in situ or an excisional biopsy. What are the options for managing this patient? This was the question asked for increasing progressive cancer. So you have to monitor her. So I have kept close observation as the correct one. And second, tamoxifen. We know tamoxifen is used because if the receptors are positive for ER and PR, then tamoxifen will be useful for it. I thought local excision would suffice because it's an in situ, but no, we have to do bilateral mastectomy. That's what I realized here. Because here is the explanation that lobular carcinoma in situ has an increased risk of invasive breast cancer. So not only you have to give chemotherapy, but you have to do prophylactic bilateral mastectomy. And the local excision would not suffice here because it can lead to invasive breast cancer. That is how you wanted to discuss this question. Now coming to sixth question, where a 35-year-old woman presented with midline swelling of the neck and complaining of loss of weight. She mentioned her mother died of thyroid cancer, age of 40 years, apple green birefringence on Congo red staining. So these are the hints that we got. I kept this as wrong because midline swelling, loss of weight is something thyroid cancer at age of 40 years. So family history of thyroid cancer is there here, weight loss and midline swelling. Staining and apple green birefringence is something which is related to amyloidosis. I knew it. Between batch have that experience, especially from Andhra Pradesh. We usually have this question in pathology days. So I knew that this is related to amyloidosis, but I don't know which cancer it is associated with in thyroid cancers. The only thing I know is 35-year-old woman. I thought while I was studying thyroid cancers, it was like this for me. This first papillary, next follicular, then medullary, and then anaplastic. These four cancers I used to study together. Then what happened was the age groups are in increasing. Like papillary is in early age group like 35. Then follicular would be at 40 to 45, and then this medullary was even more bigger, and anaplastic was 60 to 75 years of age. So keeping that in mind, I don't know anything about staining, so I just guessed it. I kept it papillary carcinoma of thyroid, but the answer was medullary carcinoma of thyroid. Amyloid deposition is something related to medullary carcinoma of thyroid. It's not related to papillary carcinoma. So sometimes it's okay to give it a guess. Also, we have to not go blindly by what we know. We have to think of it also. I mean, sometimes it may be useful, something like this, but sometimes it literally fails to questions like this. So we can't simply go on with age like in bone tumors as such. There is this amyloidosis table. If you want, you can go through it, because if you stop at everything, we can't revise every question we got wrong. Seventh question, a 22-year-old male patient is being evaluated for infertility, and sperm concentration was 10 million per ml, pH is 7.5 and volume of 2 ml. The most likely diagnosis is, I don't know whether this is a very good question to make it wrong or not. I literally did not use my brain here, because volume of 2 ml, that means what? Volume of 2 ml, at least it might be 1.6 ml, that means volume is normal. Sperm concentration is 10 million. I think it has to be 16 million or 15 million according to 2020 guidelines or something. So that has to be 16 million, but it is less here. So the concentration is less, and pH of 7.5. So sperm concentration is wrong, which we term it as oligozoospermia. I have no idea why I have kept this as azoospermia, but now that I realized that among the first questions, I am literally not interested in keeping answers at all. Please don't laugh at this question to me. Sometimes this happens. Okay, and now we are going to next question. Literally, I have got all the first questions wrong. I think last questions were correct. Okay, we'll proceed with 8th question. A young man is rushed to emergency department after suffering a stab wound over the chest wall. The entry wound is present on the left side in the mid-axillary line. The lung likely to be injured if the entry wound is above which level? This is something which is very important table. If you haven't, just go through it once. Base marking is 8th rib, mid-axillary line 10th rib, and paravertebrate is 12th, 8, 10, 12. And this is near costodiaphragmatic line. I mean, if you want to see it in a clarity, see this here. This is the costodiaphragmatic line, and this is the lower border of the lung. So if you are taking inferior border of the lung, then these are the values you have to consider: 6, 8 and 10. And if you are taking costodiaphragmatic line as the one, then you have to think about 8, 10 and 12. These are very, very important values. I have remembered that 10. Attempting this question also, I was thinking like 10th rib is the one. So above it, I have to mark it, but unknowingly I have marked 10th rib. This is a very, very blunder, I would say, because sometimes we do not concentrate on the exam much. Then our concentration is somewhere else. Marking, we know the answer, but we mark something else. That type of question is for me. Till now I have so many recall wrongs. I have 2 or 3 recall wrongs. I have conceptual questions, and this is blunder which we shouldn't do. That is what that is where you have to improve. And 9th question, this is something 3-year-old boy, sickle cell anemia, complaining of fever and runny nose. Child has a maculopapular rash with a lacy pattern on his trunk and extremities, sparing the palms and soles. So what specific complication would you anticipate in this patient? This is what he has asked. Literally, while I was attempting this question, I was completely gone blank. I have thought multiple times, what could it be, what could it be, what could it be. Now that I am reading this question, I'm completely surprised why I couldn't. Like the before one, the azoospermia one, and then this one, these are little mistakes which we make. These have to be completely avoided to get a better rank. Sorry, the best one. So aplastic crisis, we know that sickle cell anemia has 4 different type of crisis, like aplastic crisis. Aplastic crisis is something which is seen in sickle cell anemia. We know that because sickle cell anemia patients are very much prone to parvovirus B19, which will cause this aplastic crisis. And coronary aneurysm is something related to complication of Kawasaki's disease. SSPE is a complication of measles. This discussion is helping me a lot, and I am hoping this will help you too. Let's proceed. A 14-year-old boy presented with a large, rapidly progressing abdominal mass, lymphadenopathy and ascites. He was suggested prophylactic therapy to prevent the spread to CNS. A lymph node biopsy given below shows 2 different cell populations labeled A and B. Which of the following statements is false regarding this condition? So he was asking which is false regarding this. First of all, what is this? You can see A and B. First of all, I did not get the diagnosis at the beginning. The only thing I know is he is marking something in A and something in B, which made me know that it is Anthony EA or Anthony B. I mean, keeping in mind that I have thought maybe it is correct. Mass, lymphadenopathy, ascites, prophylactic therapy to prevent the spread to CNS, and 2 different cell populations. Lymphoma is something which I thought has bad prognosis, but lymphoma has really good prognosis. So it can present with 3 distinct clinical forms, and it is a very rapidly proliferating human tumor. Tumor cells are positive for CD19, 20, 10, BCL2 but negative for BCL6. Burkitt's lymphoma is also associated with BCL6. That is what you have to know. It's been long time after NEET PG 24. I have completely forgot about this phenotypes of Burkitt lymphoma. So this is something you can say it as a recall problem and also a guessing problem. I have to improve a lot on my guessing here, because what I thought was it was a very rapidly proliferating human tumor. I thought maybe it is a very bad prognostic disease, but it's not. It is a very good prognosis. It has a very good prognosis. Almost 70 to 80% cure rate is there for Burkitt's lymphoma, which I have got to know here. Basically, among my first 10 questions, all my 10 questions gone wrong. I'll show you. This is my marks. Out of 200, I have got 75 marks, where I have got 97 correct and 67 wrong. Among those 67 wrongs, my 10 wrongs were first 10 questions. I think you understand how we have to approach while doing the grand test, while assessing your grand test. I know I have did some silly mistakes. I have recall problems. I did not guess some things correct, like newborn stabilization unit or guessing this Burkitt lymphoma question. Recall problems, I have Bouchard's triad there, which I did not recall well. I have conceptual problems where I didn't understand what gastrin or how CCK works, which is a very deadly topic to me always. So I think I have to concentrate on these the next time I visit them. If you are interested in series like this, I would do much more. I would do the remaining questions also in the next videos, because the video length will be very long now. I hope this video helped you or some of you not only to get motivated but also to correct where you are actually doing wrong. I hope this helps. Thank you so much. Please keep supporting. Bye bye.